what keeps me up at night, and I've been fighting for this for years, is that EPA and other regulatory bodies keep regulating one chemical at a time. So we make recommendations about the toxicity of one chemical.
Right.
You are not exposed to one chemical. You are exposed, I could probably, if I took a blood sample from you, I'd probably find 60 different chemicals in that blood.
Right.
We need to be doing cumulative risk assessment. What are the interactions of these chemicals? Because doing this one at a time, we are seriously underestimating their toxicity.
I'm John Fox, Director of the Del Monte Institute for Neuroscience here at the University of Rochester, and I want to welcome you to another episode of Neuroscience Perspectives. I'm absolutely honoured to welcome Dr. Deborah Cory-Slechta, a pioneering researcher whose work deepens our understanding of the consequences of exposure to environmental chemicals and their impact on the brain and their relationship to neurodegenerative and neurodevelopmental disorders. Dr. Cory-Slechta is a professor here at the University of Rochester Medical Centre with appointments in environmental medicine, neuroscience and public health. She co-leads the university's Intellectual and Developmental Disabilities Research Centre, Animal Behaviour and Neurophysiology Corp, where she and I work together, and she has chaired the Department of Environmental Medicine and led its National Institute of Environmental Health Sciences Core Centre grant, now celebrating, wait for it, 50 years of continuous NIH funding. Her research spans the investigation of developmental exposures to metals, pesticides and inhaled air pollutants in animal models and human beings. And these studies have recently focused on the impact of air pollution. Dr. Cory-Slechta has advised numerous organizations, including the FDA, EPA, and CDC, and she's won numerous awards, including Distinguished Neurotoxicologist and Distinguished Toxicology Scholar Awards from the Society of Toxicology. She's also won the Susan B. Anthony Lifetime Achievement Award and the Lifetime Academic Mentoring Awards from the University of Rochester. Debbie, I'm absolutely delighted to have you here with us today, and we're going to talk about something I think that keeps a lot of people up at night. So, as mentioned in the intro, your research has been at the forefront of policy, and you've worked with various organizations, including the EPA, CDC, to advance our understanding of environmental impacts on health. Let's just start off. How did you get into this? Why did you pick up on pollutants and this particular area of toxicology?
I actually started out in a drug abuse training program at the University of Minnesota. Everybody was working on morphine and amphetamine, and I got really tired of morphine and amphetamine, and I ran across a study looking at lead exposure. It was an experimental animal study. Got very interested in it, started reading about it, went to talk to my advisor, who had no money to do work on anything but substance abuse, who said, okay, go for it. Go ahead and start doing it. And that got me involved in looking at lead exposure. And when I got finished with my thesis, there were only 2 places at the time that had any work in this kind of an area, one of which was the University of Rochester. So I ended up coming here to finish pursuing.
And I mean, take us back to that time. I mean, there's probably not a person on the planet that doesn't know that lead exposure is bad for development now. But I'm assuming then it was really just beginning to be understood in these animal models. So it was quite an exciting time for toxicology.
It was actually, there were 2 pediatricians who really brought this to the front. And the reason they brought it to the front, and this was back in the 70s and 80s, was because children were showing up at hospitals dying of lead poisoning.
Yeah.
And they said, why are children dying of lead poisoning? What's going on? That was the onus for several prospective cohort studies that then started in different areas of the world, as well as a lot of experimental animal studies. So that really was what brought lead to the front. At that time, in terms of people's understanding of toxic exposures, everything was focused on cancer, the cancer-causing potential of chemicals. Everything regulatory was cancer. So this really brought to the front, hey, there's other organs besides, other diseases and disorders, and started a long process of trying to eliminate lead from paint and gasoline, which were the major sources of exposure. Yeah.
which gets us to that interface between this kind of science and changes in policy. And again, you can't sell your house today without a lead paint assessment and an asbestos assessment, but we probably should have many, many more assessments for many, many other kinds of toxic materials that are part of our world. So you do sit at that policy interface as a scientist that really works very hard to translate that understanding into changes in legislation. And how does that work? Like, how did you get there? Is that what you ever expected when you were in graduate school?
No, it wasn't what I expected. But on the other hand, I look at it in retrospect as a great way of giving back. The lead story was probably one of the longest, and I can remember many meetings. Lead was regulated by the Centers for Disease Control for reasons that have never been totally clear, because not all chemicals are. There would be meetings, and industry members would show up and argue against the data that was continuously showing the same thing, that as the level of lead in blood increased, IQ decreased. It took us until 2012. I co-chaired a committee at the Centers for Disease Control, what's called the Agency for Toxic Substances and Disease Registry, to try to get the CDC to finally say there was no level of lead that we could deem as being safe to kids. Right. And that was shown again and again in prospective studies, one of which was carried out here at Rochester, but in Australia, other places. So finally, in 2012, we got to that point. There have been reductions going on in lead in gasoline and paint, and literally it was directly tied to the decline in blood lead levels in the human population.
Right.
We still have those exposures. They're coming in through the, piping, lead piping.
Old piping
that's
been around in houses
cities.
forever.
Yeah. In some of these areas, they will come in and replace the pipes, but the homeowner is responsible for sort of the end of it that comes into the housing.
Right.
And that doesn't get replaced.
Right. And
that's
of course, it's
not
very
really,
expensive
it's very expensive.
And this is in older houses where people who probably have less economic resources can afford to really do that replacement. And extraordinary, right? Because some of these pipes would be 100 years old, more.
Oh yeah.
And yet still leaching enough lead to be toxic.
Because the water sits in there overnight or whatever.
Yeah.
So the worst water is when you first turn on the faucet.
Yeah.
What comes out is the highest levels. So leaving it on at least for a minute or two helps that. But we'll still have these pipes in there.
That's I as somebody who grew up in an old house, we always left the taps on in the morning for a minute or so. Not great for water conservation, but very important for brain health.
Absolutely.
Oftentimes this sort of understanding about an exposure starts out with stuff that kills people. You say, okay, we need to stop that, or gives people tumors. And then you get the levels down, and that's when you start to see unmasking of actually there's a lot more going on here. And then we realize that there's intellectual issues, psychological issues. So how does it get in? Does it have an impact on the blood-brain barrier? Where does it live? And so just some of the basic mechanisms there.
So think about a mother. Think about a woman who's pregnant. She is getting lead through ingestion of food and water. There's also a little bit of lead pollution in lead in air pollution. Once it's in the mother, it is taken up by the gut, and gets into the bloodstream. And from there, it can travel everywhere. If she's pregnant, it can go directly into the fetal bloodstream. What has been different about lead is that 99% of that lead is actually in your bone, not in your brain.
Oh, goodness.
And what happens is when you are pregnant, when you are breastfeeding, during osteoporosis, the bone starts to break down and all that lead comes back out into the bloodstream. So you see over the course of pregnancy, the blood lead of the mother goes way, way up, and that's all going directly into the fetal. So it actually goes up.
It's not the immediate exposure, but historical exposure.
Historical exposure. And as we age and the bone breaks down, again, that same phenomenon is happening because lead substitutes for calcium, and calcium is what builds bones. And it can be taken up by the bone in preference to calcium. But that's where 99% of it lives.
Goodness me. And then I'm assuming a mother's breastfeeding a child, the baby is ingesting the lead, and then the barriers to the brain are weaker in that baby because they're immature. So this is why it's getting.
Correct.
Is that it? Yeah.
Yeah, the blood-brain barrier is wide open till
Right,
a
right.
kid is 6 months of age or whatever. So yeah, you're getting it. Excuse me. A child will be getting it in breast milk, and whatever it starts to eat. I mean,
Yeah,
we've had numerous episodes of lead in baby foods. This still happens.
Right.
And food,
Even
water,
today, in 2025.
Even today.
And not just in the developing world.
Oh no, not just in the developing world.
That's shocking. I think people would be shocked to hear that.
Still goes on.
Yeah, that's absolutely extraordinary. And of course, obviously, the one eating the paint chips because the lead has a sweet taste to it, and so on. This, of course, I remember from my childhood. It's a wonder I'm able to talk.
And those were some of the episodes where you would have children who'd eat paint chips, who would get a very high dose of lead, so to speak, very quickly.
So that was the canary in the
exactly.
mine shaft.
Yes.
Yeah, absolutely.
Yeah.
Goodness me. And it goes back then, going back to policy, you were talking about being on this board at the CDC, and I mean, can't put too fine a point on it. You're doing battle with big industry who it's not in their interest to have to regulate this or take it down. So we live in a very unusual political environment right now. You must be worried about this and the sort of, maybe assault on the regulatory bodies that are protecting people from these kinds of environmental pollutants.
Yes, this has been going on for a long time. The lead industry certainly fought back through this whole period of trying to regulate lead exposure. But so it took many years before now a child is supposed to have blood lead screening through their pediatrician. Doesn't always happen. They don't always get informed, just for ongoing monitoring even now. I am very worried about regulatory rollback because of the dismantling that's going on for things like the Environmental Protection Agency, where a lot of this now occurs. The scientific community there is being wiped out. The only thing that's sort of still there is that a lot of this regulation is mandated by laws, and the laws are not yet undone, but there have been ways around that by bringing in scientific committees that give recommendations to folks at, for example, the Environmental Protection Agency, bringing in people who have a very vested interest in not having regulation, who will criticize the scientific literature and say, oh no, these studies are not any good, they don't mean anything, we don't need to re-regulate anything, we don't need to regulate. Right. Yeah.
And of course, in the meantime, new regulation about new discoveries, about new particles or chemicals, that's off the table. And enforcement is the other part of it, right? So it's one thing to have a set of laws about this, it's a whole other thing to enforce them. And if you don't have enforcement, then it's,
Yeah, the enforcement is done through the regional offices of EPA.
Right.
Those, again, have been decimated. They're cutting back as much as they can.
Right.
With respect to the air pollution regulations, a lowering of the air pollution levels that would be allowable in the air was just recommended by the committee called CASAC that does that at EPA right before the election. I was on that committee. We received notification on day 2 of the administration that our services were no longer needed. There is no CASAC, this committee, at the current time. And it's already been made clear that those levels will not be lowered. Those recommendations will not be going into effect.
And I mean, in the end of the day, I really appreciate you being here. This is a very important message to get out to our community, because people on both sides of the political divide in this nation have babies.
Yes.
We all worry about the health of our children, our grandchildren, and the future of our children. And there's a reckoning coming. If we allow this to go forward, we will be visited with children who suffer. And this is, surely we can all be on the same page that that's a bad idea.
I would hope so. Yeah, I really hope so.
Tell us about paraquat and your involvement with that. Speaking of other everybody knows about lead, but they may not have heard about paraquat.
Yeah, so paraquat now has been very, very strongly associated with Parkinson's disease. Back when I was an assistant professor for reasons that I can't even remember, we started working with paraquat. And surprisingly, I immediately got a visit from some scientists at was called Syngenta, which is a chemical manufacturer located in Great Britain, that wanted to collaborate with us on these studies with paraquat, which I thought was pretty strange. But all I thought about at the time was, well, if we do that, then you don't really have control over the data. They can hold it back. And I didn't really want that to happen, so I declined. That was just the beginning of their basically trolling of our lab and all of the work that we did on paraquat. I remember in particular, we started working on developmental exposures to this particular pesticide.
And so this company had a vested financial
They
interest.
were the manufacturers of paraquat.
Where does it come from? What's it in?
It is an herbicide.
It's an herbicide,
that
right,
at that time was used literally around the world. It was the widest, the most broadly used herbicide.
So it's in a fertilizer, or is it the weed killer?
It is literally a weed killer you will see people out with wands spraying all over the place. It was used in virtually every country. It was a huge money maker for Syngenta.
I see. And
I'll tell you, at the current time, no country allows its use except for the United States and a few South American countries. They came and started trolling us. I did the developmental exposures. I'll never forget. We literally were putting pins in putting a poster up at a scientific meeting, and they were already there. The president of the society came to tell me at that meeting that I should never put the words paraquat and Parkinson's disease in the same sentence. They wanted to have a meeting.
And so had they gotten to him? Or
he worked for Dow Chemical, which is affiliated with Syngenta.
Vested interests.
Very vested interest. We were showing that it got into the brain, despite their studies that said, oh, no, it can't even get into the brain. How could it be related to Parkinson's disease? At the same time, we found that it was killing dopamine neurons in the substantia nigra, the brain region that is damaged in Parkinson's disease because of the loss of dopamine. Published those findings. They literally spent $1 million, which I tracked through the British government over here into places in the American government to do studies basically that would be done to discredit this finding. To their dismay, there were numerous other labs that at the same time were finding, guess what, paraquat kills dopamine neurons. This went on. They basically lobbied EPA to keep me off another committee that I had been on called the Federal Insecticide, Fungicide, Rodenticide Act Committee. Wow. So they regulate pesticides at EPA.
You might have had to pronounce those words to get on the committee in the first place.
It's called FIFRA, which is what everybody calls it. So they would do things like that. We just kept going. The data's the data. I'm sorry you don't like it. In the meanwhile, an epidemiology study came out. It had looked in Central California, where there's a lot of agricultural use, especially if things like paraquat goes on, and found an association with Parkinson's disease. And what's called the odds ratio for that was something like a 4.0, which is just ginormous by standards.
So massively increased risk.
Massively
if you live in this place where this is being used.
You're an applicator of paraquat.
If you're an actual person working with paraquat.
There are applicators, and in California, they keep track of who it is and what they apply. So they had wonderful data on exposure of these people. So it kept going on, and in the meanwhile, class action lawsuits got underway against Syngenta by people with Parkinson's disease. I did not testify in any of those, but I worked with the lawyers sort of behind the scenes who had begun doing depositions of the Syngenta scientists. And lo and behold, it turned out that back in 1960, some 15, 20 years before we started working with it, they had also found that paraquat killed
just like
dopamine.
with the tobacco
just like
industry.
tobacco.
Yeah.
They are required by law to turn that data over to EPA. They did not do that. And so this story goes on. We decided not too long ago, gee, why don't we aerosolize paraquat, put it in the air? Because when applicators spray it, it doesn't all fall down. It gets into the air and it starts traveling. It can travel miles downstream.
Of course,
And you will find people miles away from application sites who have paraquat in their urine or other tissue. I think they've been very fearful of this. We're now on our third study looking at the trajectory of effects when you do different durations of exposure to this. Their story was, it doesn't get across the blood-brain barrier. It very clearly does. We've shown that now multiple times, and then
and not just other people have shown that as well. This is not. So this is
they're fighting a losing
accepted
battle.
Knowledge now.
The problem is it's regulated by EPA. EPA made a decision several years ago that they were going to go and relook at the data. They had based their lack of banning of the substance here on an epidemiology study. There was sort of one study out of a cast of different studies. They've now said they're going to go back and look at it again over the next 4 years. I don't expect anything will happen in the next 4 years. Syngenta was subsequently bought out by a Chinese company, and I would note that its use is not allowed in China.
It's not allowed in China.
Not allowed in China.
But a Chinese conglomerate owns it, and it's being applied on American farms and gardens today.
At increasing orders of magnitude of use.
So it's not even that it's in reduced use.
No, its use in the last 15 years has just skyrocketed.
Goodness me.
So they're making profit off it. And in my experience, typically industry will continue until the day when the dollars from lawsuits outweighs the dollars from profits. That's how they work.
This is the kind of story folks really need to hear. I mean, this is we're talking about a scientist who's working in small animal models, and you'll hear people say, why are you working in animals? Why aren't you doing something with like developing a medicine that? And here it is, right? Working in a small animal model, this is causing really severe brain damage, and it's leading to one of the biggest. We have an epidemic of Parkinson's disease in this country right now.
Yep.
And I doubt there's a person watching in or listening to the podcast or in the country who doesn't know somebody who's suffering with Parkinson's disease. Yeah.
Exactly.
And yet we're not shutting this down, and we're not going to be doing it in short order.
No.
Very difficult.
Yes.
A hell of a story.
Can be very frustrating.
Yeah, indeed.
But you keep doing it because if people don't serve on these committees and make their voices heard, then nothing will happen.
Right. There's the policy level piece, and again, individuals out there go, well, what can I do about this? Now, obviously, you can be politically active around it and lobby folks, but what can an individual do? What do you do, Debbie Cory-Slechta, in your household? Are there things that are not allowed in your house? Are there things that you say you shouldn't be eating? What can we do about the air quality in the house? What are some of those like simple fixes?
Actually, the best thing is when lay people, when the community people get involved. When a scientist makes recommendations at EPA as part of a committee, those are recommendations.
Yeah.
They go into the bowels of EPA where they go through discussions of economics, politics, use of the compound. Do we have something different? It's really when lay people come forward and put pressure on EPA that you begin to see things happen.
Right.
Much more effective than any recommendation that an individual scientist can make.
Right.
If there is pushback from a community saying, we're not going to put up with this, that's when things start to happen.
Right. But just getting really granular, in your house, are there things that you've done, like, filtration? Are there things that people can take practical steps today, this week, next week, that would change their exposures?
Yeah, I think you have to be aware of water quality, and there are literally kits you can buy to test your water
Right.
quality. Things like that, running the water for a minute or two in
Right.
case you have things like that. I mean, I've basically changed a lot to organic foods because I have been to countries where manufacturing of pesticides goes on, and then applications where the regulations are less strict and or not monitored
Right.
in terms of things that are getting into the food supply. There is a survey called the Breadbasket Survey that the U.S. does that people can look up and see what's coming in and what levels of contaminants are in those. I don't think
So
many
imported
people
fruits
know
and
that.
vegetables and things like
Yes,
that.
you
And
can
if
look.
if they're coming from other countries, they may have had a lot of
Yes.
pesticides.
Yes,
Look at
where
that, yeah.
they're either not banned or
Right.
there's no monitoring, and so
Yeah.
it's very lax.
Gotcha. Okay, so some practical steps, and I think that's very handy
Yeah.
for folks. Phthalates. I've heard a lot about phthalates. If you give us a minute on that and how people might think about that.
So these are what we call the forever chemicals
Yeah.
because of the lack of ability to break these chemicals down once they get, so chemicals, we apply them and people think, well, that's the end of it. It's on my food or that. But they have this whole life cycle.
Yeah.
Where do they go after they get applied? Well, they can travel in water and soil and air, that kind of thing,
Yeah.
in addition to being in the food supply. Things like phthalates are a real problem because it's impossible really to break them down. And so they have effects on what are called endocrine systems, so the hormone systems of the body, the systems of the body that mediate the stress response. There are tons of these chemicals that are now around, and as things have gone forward and people have discovered, hey, these have adverse effects that we don't want, industry takes them off the market and substitutes yet a new chemical. You change one molecule and you now have a new chemical that you can introduce
And you have to
instead
start
of
the clock all over again to get.
and that's how they've been able to sort of bypass regulation on these and keep manufacturing them and keep putting them out there.
Yeah. I want to ask about you. I want to find about your travels. But one last question: is there one thing that keeps you up at night in this space?
What keeps me up at night, and I've been fighting for this for years, is that EPA and other regulatory bodies keep regulating one chemical at a time. So we make recommendations about the toxicity of one chemical.
Right.
You are not exposed to one chemical. You are exposed, I could probably, if I took a blood sample from you, I'd probably find 60 different chemicals in that blood.
Right.
We need to be doing cumulative risk assessment. What are the interactions of these chemicals? Because doing this one at a time, we are seriously underestimating their toxicity, because they can be, you can be exposed in conjunction with something else that's multiplying the effects of that chemical. We're not doing that. EPA was mandated to do this back in, 1996? We're still waiting for the first beyond a baby step in getting into this business. So this has got to come. I understand it's hard, it's complicated, but we need to get there at some point.
Going back to, you sort of think about the arrival of all of these chemicals on the market. There's an economic push for this. We need to generate jobs. We need to generate. But what doesn't get talked about is the economic implications of all that. An unhealthy populace and exposures in an infant that will travel with that person the entirety of their life, that will chart out a health course, a lower intellectual capacity course, all of this. And that has a massive impact on our economic viability.
And that is not part of the economic
Never put
equation
into
at
the
EPA.
equation.
No,
Yeah.
the economic equation is how many jobs would be lost if we can't apply this herbicide like paraquat, not the health consequences, and certainly not an understanding of the breadth of those health consequences, because you have so many different exposures that can interact.
Absolutely. Now, again, we don't want to paint a completely bleak picture, because there have been real
Correct.
changes
Yes.
in agriculture with drill farming and so on, and really people looking to this. And I think a lot of folks out there in the farming community are, even if the regulations aren't there, have really changed practices.
Yes,
for their own
because
health.
they become aware. Yes, yeah.
I see it out in
Yeah.
the rural counties
Yeah.
here in Rochester. There's a lot of Parkinson's disease. You
Yeah.
can see it.
Yeah.
You just need you need a pair of eyes, really. You don't need a medical degree. Let's talk about you a bit more, and you know, you can feel your passion for this topic here, but tell me when it started. Like, what was Debbie Cory-Slechta like as a little girl? Were you the science? Was it always going to be science?
I think it was sort of opportunistic in a sense. So I was one of 8 kids, and I was the second child. I had an older brother, so I was the oldest girl. That meant babysitting, diaper changing, pushing strollers, feeding. And so I was kind of always looking for
surrogate mom.
escape mechanisms. And it turned out we were living in Connecticut, and what backed up to our backyard were these trails that took you to something called the Stanford Museum and Nature Center, which is still there. And that that center had a little farm. It had a little zoo. It allowed us to go there and be what were called junior curators. We could go in and feed the animals when babies were born, take care of these animals. And so I spent a lot of time escaping over there, knowing my mother would never get on these trails and try to find me, and couldn't reach me. There were no phones. Fantastic. There was nothing like that. They also had a center where they had microscopes set up, so they would have science classes, and they would be set up, and I could go in there, and they would have slides under the microscope, and you're in 4th grade, 5th grade, and you look there, and it would be like, wow, it'd just be eye-opening. And I think that's where it really started, was this sort of love of, nature. I had my own baby goat over there that I got to raise and that kind of thing. I now have a grandson who I'm determined is going to be a scientist. I've already gotten him. They have these little handheld microscopes. These are so cool. And you can put like a little slide under there. I'm still teaching him how to just keep one eye open. That's the hard part right now. He can't quite do that. But I think that was it. And I spent all my life sort of going back and forth there until I got to college, and then I went to college.
Did you ever get to go into the folks in the museum down the road and say, I got my start here?
I haven't done that. I really should do that. Yeah, place was amazing.
You can imagine the folks who built that, and this is the desired effect. They did it
exactly.
so that somebody like you would be here.
That's true. I need to do that. And then my parents moved when I was a senior in high school. This is not something I would recommend for any kid.
Right.
And so our relationship kind of went downhill. I was a senior in a brand new high school. And they let me go back to Connecticut, where we had moved from that summer. That was the summer of Woodstock. So off I went to Woodstock, came back, and then my parents had no idea. Went to, my father had basically filled out my paperwork for me to go to college. Off I went. This is great. I'm away from having to babysit, be the nanny, whatever. And they had a very active and very dynamic psychology department. And
which college now are we?
This is Western Michigan University.
Right.
And B.F. Skinner came up there to visit. I mean, it was just, it was a hotbed of what was happening at the time in opera conditioning. And I got a job as a TA in one of the classes, the junior level class. And I knew at that point I was going into science. I just didn't know what area of science it was going to be. And then I got involved. I decided I would go do a PhD at the University of Minnesota, where they were doing a drug abuse training program, because it was a mixture of behavior as well as pharmacology.
Right.
So that was kind of the path that I went on.
So at that point, you're really in the psychological sciences.
Yeah, doing a lot of behavior. I mean, people were doing a lot of that. That was when drug abuse was really starting to be studied, not just in humans, but in animal models of drug self-administration. And when I sort of got onto this thing and said, oh, I really want to do lead exposure in animals and see what happens. And that was where I sort of took off into the world of toxicology.
Amazing.
And a postdoc here at the University of Rochester, where an individual named Bernie Weiss, who was my mentor, was one of two people in the U.S. who was concerned about chemical exposures and how they were affecting the brain.
In the U.S.
There were literally two people.
Amazing.
The other place was the University of Wisconsin at their primate center.
Right.
They were, I think, working on the time at things like PCBs, which we don't have anymore, which is one of the success stories.
Right.
But yeah, this was one of the few places you could do that. And Bernie was, again, another wonderful mentor and saying, hey, you know, he kind of let me go do my thing, trusted me enough to say, okay. And that took off. I got involved in these pediatric, one of the cohort studies of lead exposure, and was doing animal models at the same time. And that had a huge influence on me, the pediatric cohort study, because these mothers would come in every 6 months with their child. We were doing cognitive testing. We would take blood from the child. And I remembered, you know, the mothers would say, you know, I can't afford to pay the rent. I can't afford groceries. Now I've got to worry about lead exposure. And going back to my lab and sort of looking at that time, a rat in a cage who was getting lead in a drinking water and thinking, wow, this isn't anything like what they go through. Got me on this cumulative risk sort of thing.
Right.
Started saying, well, what are the effects of stress combined with lead exposure? It sort of got me into that whole realm of thinking about these things acting together, and how much worse it was.
Biopsychosocial perspective, practically. Like we're a whole organism experiencing.
Well, and even from a physiological perspective, I don't know a single metal that doesn't act on the same brain sites and the what's called the HPA axis that mediates stress, like lead does. So in conjunction with stress. So started working on models of that, which ultimately spread to the human cohort studies. They started asking similar kinds of questions about these interactive effects. And, you know, guess what? When you put them together, things look a lot worse than they do alone, which is
of course,
my concern over cumulative exposure.
Yeah, I think I mean, it's a fantastic story, and thank you for sharing that with us. You know, I think one of the things in modern society is we forget that for almost all of human history, there was no industrialized world.
Correct.
There were no herbicides, pesticides, lead, paint, none of that. And we're looking at things like an environment that really started in the early part of the 19th century.
The Industrial Revolution. Although lead was around at the time of the ancient Greeks and Romans.
That's right.
And they were well aware of its toxicity.
Incredible, right?
Yeah, well aware of its toxicity. Well, they had miners who were mining lead, and they showed up with lead causes a peripheral neuropathy, something called wrist drop and ankle drop. And that's where some of this originally showed up, but it was really prevalent in the drinking water. They used leaded glassware and glazes, so they were ingesting huge amounts of this.
Wow.
So they were quite aware of that. That's where using toxicants to eliminate some of your enemies started, actually because of their knowledge of some of this kind of stuff. So that was, some of those kinds of things were around, but very little else. A lot of this is the time of the Industrial Revolution, and I think about it now because, you know, when metals accumulate in your brain, the brain doesn't really have a way to get rid of them. It probably didn't need to, because the blood-brain barrier would have controlled.
It's not part of our evolutionary history.
Correct.
Right.
Didn't need a way to get rid of it. So now we don't have that, and yet we're accumulating them.
Debbie, you know, one thing that comes up time and time again when somebody sitting in that seat is these sort of pivotal moments where a particular person like Bernie picks up and is that key mentor who just sets you off on a trajectory. And maybe one of the great privileges we have sitting in our seats is that we get to do that too. A word to the wise. What would you say about mentorship style? And maybe speak a little bit to what it was like to be a woman in neuroscience and toxicology, if you wouldn't mind.
Okay. Mentorship-wise, I like to be kind of hands-off. I like to see somebody who's passionate and motivated and has ideas and that they can contribute to. Let
Right.
them lead the way, so to speak. And that's how I've done it, not only with students, but there's some junior faculty that I've mentored at different institutions with some of the awards that we have. And, because one of it's selfishly, a fun thing is to watch them succeed,
Yeah.
right? And so, watching them succeed is why I do that.
There's
in
nothing
part.
better. I don't
Nothing
think there's
better.
anything better. Yeah.
It's like your own kids, right?
Yeah.
You want them to succeed. You can't do it for them.
That's right.
So, I want to see them, take these steps and to succeed. So I've done quite a bit of that. Coming up as a woman in this field or in any field at that time, was difficult because you always had to be better than to be equal to.
Right.
And
Better than to be equal to.
correct.
Yeah.
Correct.
Right. Well put.
And so that was difficult. I had episodes that we didn't have offices that you could report abuse to at the time. You just had to suck it up and keep moving on. Develop a thick skin, so to speak, and keep going on. I mean, I think, so driven by the science, and I wasn't going to let anybody, I wasn't going to let something like that get in my way.
Yeah.
So I just kept going.
And advice to a youngster today, first-year graduate students coming into the sciences, how would you say? What would you say to them about navigating successfully in the 2025 science world?
I think, do some homework, learn some things, and don't be afraid to contribute your ideas. Everybody has good ideas. Our lab works as a kind of team, and everybody brings something to the table to contribute. It doesn't come from me. It comes from everybody. And so, don't be shy. Don't be timid. Speak up. That's what I like to see. I learned that as one of 8 kids very early on.
Of course, yeah.
Sometimes in a rather profane way, but that's a different story.
Well, we kept it clean here today, at least.
Right.
Debbie Cory-Slechta, thank you so much for taking the time out with us. That was an absolutely fascinating conversation.
Thank you.